Hello friends, welcome all of you on my YouTube channel here, Anand's Nursing File. Today in this video, we learn about the nursing care plan for patient with malaria. This is very important nursing care plan for the examination purpose or for the practical file purpose. In this video, we make here the very simple and easy nursing care plan, and through this video, you learn this nursing care plan very easily. And for this, you see this video thoroughly and learn with this it. And देखते हैं आज का नर्सिंग केयर प्लान हमारा मलेरिया. Here, before going to nursing care plan, we learn first here the short introduction about malaria and their defining characteristics. Here, first, malaria is a life-threatening disease caused by the parasitic that are transmitted to people through the bite of infected female Anopheles mosquito. Here, defining characteristics means sign and symptom for malaria may include fever, chills, general feeling of discomfort, headache, nausea, vomiting, diarrhea, abdominal pain, muscle or joint pain, fatigue, rapid breathing, rapid heart rate, and cough. On the basis of these clinical features or sign symptoms, we make here the nursing care plan. Here, nursing care plan for malaria. Here, first nursing care plan. Here we use different nursing processes step. यहाँ पर हमने जो नर्सिंग प्रोसेस स्टेप जो हम यूज़ करते हैं केयर प्लान के लिए नर्सिंग असेसमेंट डायग्नोसिस गोल नर्सिंग इंटरवेंशन रेशनल एवेल्यूशन जो हमने लास्ट में दिया हुआ है वो देखते हैं. तो यहाँ पर हम फर्स्ट नर्सिंग केयर प्लान देखते हैं. यहाँ पर रिस्क फॉर इन्फेक्शन रिलेटेड टू डिक्रीज इम्यून सिस्टम. नर्सिंग असेसमेंट होगा सब्जेक्टिव डाटा नॉट एप्लीकेबल बिकॉज दिस इज द रिस्क डायग्नोसिस and their objective data assess vital sign monitor sign of infection monitor blood test. Nursing diagnosis होगा risk for infection related to decrease immune system goal होगा to decrease risk for infection. Nursing intervention rational देखते हैं. First intervention provide isolation monitor visitors as indicated. ये rational होगा reduce the risk of possible infection. Number second intervention होगा वाश एंड बिफोर एंड आफ्टर एक्टिविटी डेस्पाइट द यूज ऑफ aseptic टेक्निक्स एयर एंड यूज ऑफ aseptic टेक्निक्स. रीजनल होगा रिड्यूस क्रॉस कंटामिनेशन. नेक्स्ट नंबर थर्ड इंटरवेंशन मॉनिटर द टेम्परेचर. रीजनल होगा फीवर इज द साइन ऑफ इन्फेक्शन. नंबर फोर्थ ऑब्जर्व द चिल्स एंड डायफोरेसिस. ईयर rational होगा shivering often precedes the height of the temperature on the infection. Number 5th intervention monitor sign of deviation condition failure to improve during the therapy. Irrational होगा may indicate inaccuracy antibiotic therapy or growth of the organism. Number 6th interventions collaboration of the anti-infective drugs as indicated. Irrational होगा can eradicate provide temporary immune to infection. Number 7 can eradicate provide temporary immunity to infection. Number 7 interventions get blood sample for laboratory studies. Here rational होगा for identifying the cause of malaria infection. After providing these interventions, we write here the evaluation steps. Now here evaluation is decrease risk for infection. तो ये था फर्स्ट केयर प्लान. नेक्स्ट देखते हैं केयर प्लान नंबर सेकंड. यहाँ भी हमने सेम नर्सिंग प्रोसेस स्टेप यूज़ किए. नर्सिंग असेसमेंट डायग्नोसिस गोल इंटरवेंशन रेशनल. फर्स्ट देखते हैं सब्जेक्टिव डाटा. एयर पेशेंट एक्सप्रेस फीलिंग weak and tired, and objective data weight loss, generalized weakness, decreased activity, intolerance. On the basis of these data we write here the evolution we write here the nursing diagnosis. Here nursing diagnosis is imbalanced nutrition less than body requirement related to inadequate food intake, anorexia, nausea and vomiting. Goal होगा to maintain nutritional status. Nursing intervention rational like the first intervention assess nutritional history including the prepared food, observation and record food intake. Rational होगा this action is to monitor caloric intake or lack of quality of food consumption. Number second intervention Advise patient to eat small and liquid diet here. This action is helps in easy digestion and liquids to replenish fluids. Number 13 interventions देखते हैं. Maintain schedules of regular weighing air ration होगा. This action is overseeing the effectiveness of the weight loss or nutrition intervention. Number 4 interventions देखते हैं. Discuss the food and diet plan here ration होगा. This action is to increase the input, increase the sense of participation, control diet. Number 5 interventions observation and record the occurrence of nausea, vomiting and other symptoms associated ration होगा. This action is gastrointestinal symptoms can show the effect of anemia, hypoxia in the organs. Number 6 collaboration for referral to a dietitian. Operation होगा. This action is necessary help in the planning a diet that meet the nutritional need of the clients. After providing these interventions, we write here the evaluation steps for this care plan. Here evaluation is maintain nutritional status. Next देखते हैं care plan number 3. केयर प्लान 3 के लिए भी हम सेम जो स्टेप्स यूज़ करते हैं. नर्सिंग असेसमेंट, डायग्नोसिस, गोल इंटरवेंशन, रेशनल एंड evaluation last में. First nursing assessment subjective data here. Patient is saying that is feeling well. Objective data assess vital sign here. Nursing diagnosis hyperthermia related to dehydration, increase metabolism, direct effect of circulating germ in the hypothalamus. गोलों का to reduce fever. इंटरवेंशन रेशनल देखते हैं यहाँ पर. फर्स्ट इंटरवेंशन मॉनिटर द पेशेंट्स टेम्परेचर डिग्री एंड पैटर्न, नोट द चिल्स. रेशनल होगा हाइपरथर्मिया सोड एंड एक्यूट इन्फेक्शियस डिजीज प्रोसेस पैटर्न सच द डायग्नोसिस ऑफ मलेरिया फीवर. नंबर सेकंड इंटरवेंशन मेंटेन एनवायरमेंटल टेम्परेचर. हियर रेशनल होगा इंडोर टेम्परेचर, number of blankets to be changed to maintain near normal temperature. Number third intervention give warm compressed bath, avoid the use of alcohol rational to help reduce the fever, and the use of ice alcohol may cause freezing. Addition of alcohol can also cause dry skin. Number fourth intervention देखते हैं. Give antipyretic drugs. या rational होगा. It is used to reduce fever with central action on the hypothalamus. Number fifth interventions give a cooling blanket. Here this blanket is used to reduce the fever with hyperthermia. After providing these interventions, we write here the evaluation steps. Now your evaluation is now patient's normal body temperature maintained. Next देखते हैं care plan number 4. Here we using same steps in nursing assessment, diagnosis, goal intervention, rational. First subjective data, patient verbalize about overwhelming tiredness and disability to perform activity and breathing difficulty. Objective data here, generalized weakness, irritability, fatigue related to muscle weakness, abnormal vital sign. Here nursing diagnosis होगा ineffective tissue perfusion related to a decrease in the cellular components needed for the delivery of oxygen and nutrients in the body. Goal होगा to maintain effective tissue perfusion. Nursing intervention rational. The first intervention maintain bed rest to help with maintenance activity. Rational होगा reduce myocardial workload and oxygen consumption, maximizing the effectiveness of the tissue perfusion. Number second interventions monitor the blood pressure trend, noting the development of hypotension and change in the pulse pressure. Rational होगा hypotension will develop along with the germs that invade the blood. Number third interventions monitor the quality, the strength of peripheral pulses. Rational होगा at the beginning of a strong rapid pulse due to an increase in cardiac output, pulse weak or slow due to ongoing hypotension, decreased cardiac output and peripheral vasoconstriction. Number fourth interventions assess respiratory rate and depth of the quality. Note the severe dyspnea. Rational होगा increased respiration occur in response to the direct effect of the bacteria on the respiratory center. Breathing becomes shallow in the event of respiratory insufficiency, raises the risk of acute respiratory failure. Number fifth interventions give parenteral fluids here to maintain tissue perfusion. A large amount of fluid may be required to support the circulatory volume. After providing these interventions, we write here the evaluation steps. Here evaluation is maintain effective tissue perfusion. Next देखते हैं फिफ्थ केयर प्लान here. यहाँ भी हम सेम स्टेप यूज करेंगे. नर्सिंग असेसमेंट, डायग्नोसिस, गोल इंटरवेंशन, रेशनल. फर्स्ट नर्सिंग असेसमेंट में सब्जेक्टिव डाटा एंड ऑब्जेक्टिव डाटा देखते हैं. फर्स्ट सब्जेक्टिव डाटा, patient having no knowledge about malaria when asking questions. Objective data, looking anxious and restlessness. Nursing diagnosis, a knowledge deficit related to lack of exposure and information about the disease process, its treatment, prognosis. Goal होगा to improve a level of knowledge. Intervention, rational. First intervention, review the disease process and future expectations. Rational होगा provide basic knowledge of the where the patient can make a choice. Number second intervention, provide information on the administration of the drugs, drug interaction, side effect, and adherence to the program. Rational होगा to increase understanding and enhance cooperation in healing and reduce recurrence of the complication. Number third interventions, discuss the need for proper nutritional intake and balanced diet. Rational होगा the need for optimal healing and general well-being. Number fourth intervention, encourage period of rest and activity schedule. Rational होगा and energy saving and improve healing. Number fifth interventions, review the need for personal hygiene and environmental cleanliness. Rational होगा exposure control, help the environment by reducing the amount of the existing cause of disease. Number six interventions, identify the sign and symptoms that require medical evaluation. Rational होगा early recognition of progression, recurrence of infection. Number seven intervention, emphasize the importance of anti-malarial treatment as needed here for therapeutic regimen for the malaria patient here. After providing these interventions, we write here the evaluation step. Now here evaluation is improved level of knowledge. तो फ्रेंड्स ये था मलेरिया का नर्सिंग केयर प्लान. एक बार फिर देखते हैं यहाँ पर. दिस इज द शॉर्ट इंट्रोडक्शन अबाउट मलेरिया एंड here this is the first care plan, risk for infection related to decreased immune system. Here this is the second care plan था यहाँ पर, impaired nutrition less than body requirement. And next number third intervention, third care plan था यहाँ पर, hyperthermia related to dehydration, increased metabolism, direct effect of circulating germ in the hypothalamus. Next year ineffective tissue perfusion, number care plan fourth. And fifth care plan here, deficient knowledge. तो ये था नर्सिंग केयर प्लान फॉर पेशेंट विद मलेरिया. तो फ्रेंड्स आपको वीडियो कैसा लगा, इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस मलेरिया नर्सिंग केयर प्लान विद योर फ्रेंड्स and subscribe my YouTube channel here, Anand's Nursing File, preparation for the nursing competition examination. And we provide here various different nursing related subject material, image based question, nursing care plan, case history, family folder. तो फ्रेंड्स आप यहाँ चैनल पर सारी चीज़ देख सकते हो, लर्न कर सकते हो. तो फ्रेंड्स बेल आइकन को जरूर प्रेस कीजिएगा जिससे कि हमारे सारे वीडियोज आपके पास समय समय पर पहुँचते रहें. तो फ्रेंड्स please subscribe my YouTube channel. Thank you.